Next, let's talk about how we stage neurocognitive disorders. So this simple diagram should help you understand how major neurocognitive disorders or dementia progress. So it usually starts by a preclinical phase where there are some brain changes and the patient may notice that something is different about them. But when we do history taking, physical exam, cognitive exam, we can't really detect measurable deficits. And then MCI follows, where we notice difficulties in some cognitive domains, one or more, that we could measure on testing, but it has not affected the patient's ability to function independently. And then dementia comes after, as we had described in previous slides. So allow me to break it down a little bit further, talk about pre-dementia and then different stages of dementia. The pre-dementia is essentially the mild cognitive impairment stage, which can be easily missed, usually diagnosed in retrospect after dementia had already started. Deficits are not severe enough to affect daily functioning, and that's why they do not present soon enough to their doctors. Episodic memory recall, which is short-term memory in other words, and word-finding difficulty is a common presentation. Around 15% of those individuals will end up developing dementia each year, and a third of those with amnestic MCI develop Alzheimer's disease within 5 years. This stage is ideal to establish the advance directives and protect the person's wishes regarding their care, including end-of-life care, before their cognition starts to deteriorate further, making this process much more challenging. So in early dementia, symptoms becomes more noticeable even to others around the patient. It starts interfering with daily activities, and on the mini mental status exam, the score's somewhere between 18 and 24. Early symptoms are dependent on the type of dementia. So for example, you see more memory problems with Alzheimer's disease, more executive dysfunction with vascular disease, more behavioral changes with Lewy body dementia and frontotemporal dementia. They may need assistance and reminders with some or many tasks, and patients are usually aware of these deficits, leading to frustration, anxiety, or depression. Sometimes they become quite angry, either with themselves or with their caregivers if they start correcting them too often. Next is middle or moderate dementia, where the initial symptoms that we mentioned on the previous slide start getting worse. Scores on the cognitive testing will start falling between around 10 points to 17 points out of 30. Patients cannot usually function outside their own home and generally should not be left alone at this stage. Simple tasks might be still doable, but the instrumental activities of daily living require thorough assistance or very close supervision. Patients typically lose insight into their deficits and may attribute their struggles to some delusional or hallucinatory reasons, and they cannot be left alone during that stage. Late or severe dementia, where the symptoms continue to progress and worsen, the scores will start falling on the mini mental status exam below 10. Patients will need assistance with all their activities of daily living and all their instrumental activities of daily living. 24/7 supervision is usually needed. Falls and wandering becomes much more concerning and much more frequent. You may notice some incontinence in urine and in stool. Sleep and appetite changes become much more prevalent and much more problematic. Motor deficits ensue later on, impairing their ability to move, to walk, and to swallow their meals. Food may need to be liquidized into puree forms, and you may have to consider other needs like using diapers, chucks, and so forth. So there are so many different scales that can be used to stage the dementia, but these are the three most common used in clinical and academic settings. The first one is called the CDR, or the Clinical Dementia Rating. The second is the Global Deterioration Scale. It's also known as Reisberg Scale. And FAST, which is the Functional Assessment Staging Test. And under this video, I'm attaching copies of these rating scales for your use. So, are all dementias considered the same? Is it just all about memory loss with some icing on the cake? Well, depends.